Hi, I'm Mark Mazzaferro, and it's time for another episode of Fire Facts. And with us, as always, on Fire Facts is Fire Chief and COVID-19 expert Chris Concepcion. Chris, how you doing today?
Good. How about yourself, Mark?
I'm doing well, thank goodness. Knock on wood.
Good.
Of course, we're here today to talk about the obvious, provide some updates on what's happening here in Vacaville, regionally, and around the nation, I guess, in terms of the coronavirus situation. So, right off the bat, why don't you just kind of get us started and let us know where we're at here in the region?
Absolutely. I'm not going to give any numbers just because it's changing. It seems like on a minute-by-minute basis, and obviously the number of cases at this point is continuing to increase, especially in New York and throughout the country. So, but as far as locally here, just to give you a little history, we became aware of the situation at the end of February when we were told that the fire department was told that we couldn't transport any patients to Vacaville and North Bay hospitals. We weren't given a reason at that point, but then later we found out that the reason was that they were handling the first what they call the community transmitted case of COVID here at Vacaville. So they were dealing with that, and since then it seems like things have been changing on a minute-by-minute basis. And so as far as the city is concerned, we've been monitoring the situation very closely. As everyone probably already knows, there was a proclamation of a local emergency here for the City of Vacaville on March 17th. That was ratified on March 24th by the City Council. So that proclamation then, or that resolution then goes for 60 days, at which point, if it needs to be extended, it will be extended by the City Council. But there's a few things as far as the residents should be aware of is as of, I believe it was March 18th, when Solano County joined other counties within California that had issued, Solano County called it a shelter at home, which is more appropriate than the other term that the other counties were using.
Let's not even mention
I'm not even going to mention it. That's why I said. So the order that we are under right now is either shelter at home per the county, and then on March 19th, which was the very next day, Governor Newsom issued a stay-at-home order for the entire state.
Mm-hmm. So that's kind of where we're at now. We've been trying to provide as much information as we can through our channel, social media, website, Channel 26, even our radio station.
Yes.
And of course, the more information you provide, the more questions it creates. So I've got a few I'd like to bounce off of you and see if we could get some good information out there. One thing I am hearing from folks is that there's lots of bad information.
Yes, there is, absolutely.
And I want to encourage people to go to our website. Our website has links to just CDC, the Solano County Department of Health, our information that we're putting out. I like to think that information is as accurate as it's going to get.
Yes.
So anyway, so one of the questions I hear is, why isn't there more testing being done in Solano County? And then why aren't they? Well, we'll start with that one. Let's start with that.
The reason for that is there's a very limited number of tests. Mm-hmm. So the tests that are the folks that are being tested right now are the people that are symptomatic. They fall within the CDC guidelines of the people that need to be tested. Mm-hmm. And if you look at it, and then I mean, you could argue a bunch of different ways. There are some people that are asymptomatic, or I should say without symptoms, is what asymptomatic means. That they don't have any symptoms, and they supposedly were in the same room or came in contact with someone that might have had COVID-19, and then because of their status, they've were able to get tests. You know, we won't get into politics, but the reality of the whole thing is there are a very limited number of tests that are available. And so testing someone that doesn't have the symptoms really doesn't give us any information that we can make use of. And truly someone that, you know, that doesn't have any symptoms, they get tested today, that comes back negative, they go about their daily lives, doesn't mean that they can't get it.
Right,
You know,
it's not
from someone
preventative
else.
in any
Right.
way, shape, or form.
Right, yeah.
So,
The testing gives you a snapshot of picture in time.
Right.
And that's all it does.
okay, the other one, you said earlier you don't want to mention any numbers, and,
Yeah.
and I agree with you, because before I came in, I saw a bunch of new numbers.
Yes.
So by the time this is on the air, those numbers will all be wrong as well.
Yes.
But very generically speaking, one of the questions I've gotten is, how come we don't know how many cases there are in Vacaville? Other communities know how many cases they have, like San Francisco. Can you answer that? Can you explain
Well,
that?
first of all, San Francisco, most people know that San Francisco is a county as well as a city,
Right.
and it covers the same exact area. The reason that we don't have the numbers specifically for Vacaville, and that could be frustrating for some, but the reason we don't have that is because we don't have a public health department within the city that keeps track of that information. The information is tracked at the public health level, which for us, it is the Solano County Public Health that keeps track of that information. So therefore, as granular as we're going to get, or as specific as we're going to get here in Solano County, is by the county. It's
Right.
not going to be for the specific cities.
And on the one hand, I understand people want to know, right, what's
Sure.
going on in their community. On the other hand, whether there's one case or 10 cases in Vacaville, it's not going to change anything that we're doing in the community.
Absolutely not. And you make a great point. It makes no difference whether we have 0 cases here and all the other cases are somewhere else in Solano County, or whether all of the cases are here in the city. We still need to do the best to do our part, and that is the goal for the entire country, not just for Vacaville, but for the entire country. We all need to do our part to slow the spread of COVID-19.
Right. Now, another question we're getting a lot is, how come the parks aren't closed? And I think bad on us, we kind of confuse people when we close the playgrounds,
Yeah.
but not the parks.
Right.
And the playgrounds are still closed, but the parks aren't closed. So what's the reasoning, the logic behind that?
Well, so if you go back to the Solano County shelter at home order, as well as California's stay at home order, it doesn't say, it says stay home to the extent possible, right? Except for to seek medical help or to go get food. But it doesn't say stay inside. You know, you want to get some fresh air, you're gonna need to go get some fresh air, and it is okay to go outside. The biggest thing is the biggest thing to remember is, if you do go outside, is you need to then maintain social distance from strangers, because the closer you are to someone, the higher likelihood that is that, if you're positive or if they're positive, either you giving it to them or them giving it to you. So you have to maintain your distance. So we are meeting every day, as you know, the senior leadership of the city, and we deliberate on these things very carefully, and we're looking at what's best for the residents of Vacaville, that we can still have some semblance of what a normal life, I guess you could say, versus complying with the orders. And we felt it best, since people are allowed to go outside, it's okay to go to the park. But the thing to remember is, if you feel that the park that you go to is so busy that you can't, you're going to get too close to people, go to another park. Right? It's that simple. But the open spaces are the open. I think we have enough open space and we have enough green space here in the city that the folks can go out to and enjoy, continue to enjoy those spaces, and still yet comply with the 6 feet social distancing that we're asking everybody to comply with.
Right, and now getting back to what you said about our daily meetings, our staff is spending a lot of time trying to stay as informed as possible about what's going on, aren't they?
Absolutely, yes. I mean, we and that is the other thing too, and you had alluded to that, you know, there's a lot of bad information out there. So we are monitoring this situation very, very closely. All of the department heads and key staff of the city are getting together on a daily basis. Our Emergency Operations Center is open. As information comes in, we have to make sure that we are getting information from good sources. We vet that information, and then we disseminate that. We get that information out as quickly as we can to the residents of Vacaville.
Now, just to reassure our residents, I think it's fair to say that we're trying to, here at City Hall and throughout the city in general, try to maintain as normal level of operations as we can.
Absolutely, yeah. So that is a key thing. We can't completely. I mean, we feel for all the businesses that have had to stop, but there are essential services that have to continue, and so we want to make sure, you know, the government and City Hall. We do a lot of different things here in the city that support a lot of those essential services throughout the community. So therefore, all of our employees have had to come to work, and we're trying to have some semblance of normalcy. You know, we've had to slow things down. You know, our public counters are closed to walk-in business, but we're still conducting business, but only on a by appointment basis.
Well, I think too, I mean, we've been trending this way anyway throughout the last anywhere from 10 to 20 years of doing everything online.
Yes.
I mean, at some point, you will never set foot in another building in your life, whether it's City Hall or Safeway, you know, because you'll pull out your phone and press a few buttons and a truck pulls up and drops off 2 bags of groceries.
Yeah, I mean, and I'm old school, so I'm sad to see that, you know, and I'm too much of an extrovert, and I like being around people, but you're absolutely right. There are so many services in the city that and the type of business that you conduct with the city that you can do online. I mean, you can submit plans online. You can pay your water bill online. You know, under our website that, you know, you've done a great job of setting up. You know, you go to www.cityofvacaville.com
slash COVID-19.
Well, no, before you even get to that, though.
Oh, sorry.
Yeah, before you get to that, though, you go to the homepage of the website, and you go to the homepage of the website and it says, I want to.
Right.
And all of those online things that you're able to do are right there.
But the separate page has got, calls out specific links to specific departments even, if you want to call Public Works to make an appointment, planning, fire, police. All the departments are listed there. So any business you need to do with the city, you can still do.
Yeah, absolutely.
Yeah. Well, anything else you want to share about what's going on out there? Well, oh yeah. Let's talk about public safety and what's going on with your guys and gals and the PD, because I mean, they're right in the middle of it. They're face to face with this situation.
Our police officers and our firefighters, they're on the front line. They have to keep coming to work.
Yeah.
And they're working hard. I can assure you from, you know, I'm talking daily with Chief Carley, and you know, he's making sure that you know, the PD is out there and keeping the city safe, because, and then for us, you know, 911 doesn't stop. People don't stop getting sick because of the fact that, you know, we got COVID, we've got other things that are going on. Fires don't stop. So we have to have our firefighters out there on the front line. So I can assure you, and I want to ensure the community, that all 5 of our fire stations are still fully staffed and will continue to be so. You might see some of the, you know, you might see some of our firefighters that are out there in the neighborhood. They're practicing social distancing, which we're making sure that they do that while they're at work, but they're out there training. They may be out there pulling hose or throwing ladders or something like that. And the reason being is other emergencies don't stop, and we have to be prepared for that. So that's why they continue to train.
All right, good deal. Now we're in a little bit of a transition here at City Hall. Do you see that impacting anything moving forward for us?
Absolutely not. No, there's we're going to move forward as far as the city is concerned, and our senior leadership within city staff is meeting on a daily basis to address this COVID-19 thing. We're going to get through it. We're doing well, and we'll move forward.
Yeah, I had this conversation with a coworker a little while ago about how, these things come along, whether it's the Great Recession or an earthquake or a fire, and at the moment it's dire, but at some point things return to normal.
Yeah, and I've been through many of these emergency incidents, from a short-term fire that lasts a couple of hours to, I've been on campaign fires that have gone for 6 weeks at a time, and you work them, and then I've been on hazardous materials calls that have lasted 2 weeks, and so you take each one of these incidents and you get through it. There's what we call a mitigation phase. You're making the problem go away, and then after that, then there's a recovery phase. Whether it be earthquake or flood, you're you're taking care of the problem, and then after the problem has been taken care of, then you have to guide the city through recovery, from that, because there are implications as a result of whatever emergency you've gone through. This happens to be a pandemic. But we're in the mitigation phase right now. We're working to slow the spread of COVID-19, and then once we've taken care of that issue, then we'll see how it's affected the city, and then we'll guide the city through the recovery of that.
Okay, great. Now we have set up some things for people who need assistance, in particular seniors,
Yes.
Disabled, and vulnerable, quote-unquote, vulnerable populations.
Yes.
You want to talk about that?
Yes, so we've set up a hotline, and they can call the number, and you've got the number, right?
707-449-5100, and then press 0.
So we're matching up the folks that need help with those folks that are wanting to help. And if it's anything like going out and doing some shopping for the seniors that are stuck at home as a result of this order, or any other kind of, as you had said, the vulnerable population that need help, please call that number. There are, from what the last we heard, there are plenty of volunteers that are willing to help. That's what makes Vacaville such a special place, is we've got lots of people that want to help out.
Yeah, it's a great community, and like you said, this too shall pass.
Yes.
And we'll get through this. Anything else you want to add, Chief?
Yeah, I just want to make sure that let everybody know that as we said, this COVID-19 thing, it'll pass. But the key right now, our top priority, is to slow the spread of COVID-19. And remember, please take the shelter at home and the stay-at-home orders by the county and the state seriously. We need everyone to take those very seriously. So stay at home to the extent possible. Only go out if you need to seek medical help or medical attention. Also going out for food. And then remember, as far as the food options are concerned, in a lot of our small businesses that are used to mostly dine-in options now are offering a dine-out option. They're still, they're still open for business, but help the small businesses out in Vacaville. And the best thing about it is either they do curbside, so you don't even have to leave your car, or even better yet, they'll deliver.
Yeah.
A lot of the places, will deliver, so you don't have to leave your house.
Well, we got a list on our website of businesses that are operating. A lot of restaurants and a lot of retail type service providers are still working. They're considered, many of them are still essential businesses. So, and in putting that together, certainly in the restaurant side, I was really surprised to see how many restaurants now you can use DoorDash, Uber Eats, Grubhub, food jets, if they're still around, or they deliver it themselves. I mean, you almost, as I said earlier, you almost don't have to leave your home for anything anymore.
Yeah. But if you do leave your house, you want to just get some fresh air, you want to go outside, you want to visit a park or take a walk, please remember social distancing. You want to maintain a space of about 6 feet around you, right? And then at all times, always at least stay an arm's length away. So you see, we're following that. We're following that order, right? So always follow that at least an arm's length away. And then follow good hygiene practices. And what I mean by good hygiene practices, wash your hands regularly. Use hand sanitizer if you can't wash your hands. The CDC says, washing your hands saves lives, and in this case, it truly does. Cover your nose and mouth when you sneeze or you cough, and the surfaces in your home, or if you're having to continue to work, wipe off those surfaces that you use regularly with a disinfectant. And so we'll get through it. I mean, if you can remember those things, we don't know how long these orders are going to go on for, but we're all in it together. Well, I mean, apart, but together. You know what I mean by that.
And not in literal terms.
Right. But we'll get through it, and Vacaville is a strong community, and I've got all the faith in them.
We've gotten through other things, so why not this too, right?
Absolutely.
All right, good deal. Chief, thank you very much for the update. I have a feeling that we'll be providing more updates on a far more regular basis after this, just because of what you said earlier, that the situation changes, if not daily, hourly, by the minute. So, so good deal. Thank you for keeping us informed, and for you and your crews for keeping everybody safe out there too. And thank you all for watching this episode of Fire Facts. We'll see you next time.